Welcome back to the Daily Vlog. My name is Dr. David Duizer. Thank you so much for tuning in. I'm a naturopathic doctor focused on chronic care, and I'm happy to have you here on the show today. Today, I want to do a quick update about COVID-19, about the coronavirus, because I find that there is a ton of information out there that might be misleading, and it makes it extremely difficult to slow this pandemic down when there's information all over the web that is actually promoting the spread of the pandemic. So what I really want to cover today is three things. The first thing is that based on some literature that has come out of countries where they're able to test much of their population, we're finding out that there are many people who are asymptomatic. So they're walking around with the virus, contagious without symptoms. Initial reports from China were that the asymptomatic cases were a low rate, but now we know the rate could be much higher than what was reported. So just because you don't have symptoms doesn't mean you shouldn't be in social practicing social distancing. Please practice social and physical distancing as much as possible, even if you don't have symptoms. The second thing I want to cover is that symptom onset is delayed. It's really important to know that if you have been traveling or if you've been near someone who has the symptom profile or has been traveling or you suspect might have the virus, you could also have it and be asymptomatic and have the symptoms come on later. It can take 4 to 5 days for symptoms to come on, sometimes less, sometimes more. The third thing I want to cover is that it's really important to know that there are an assortment of comorbidities that make this disease worse. We don't know the whole list yet. We know that high blood pressure is bad. Obesity could make it worse. We know that aging populations are more at risk of the most serious form of the disease, which is the pneumonia, that can occur, and then the need for ventilatory support. So it's really important to note that there are comorbidities that putting people at risk. It's also important to note that part of that profile is that some people just genetically are more at risk of the inflammatory, the cytokine storm that happens in the most serious phase of this virus. So some people randomly are getting to that most aggressive stage, even if they don't have some of the comorbidities that are documented. We're seeing younger people reach that more serious stage, and that is extremely concerning. For those people, they don't fit the typical profile: elderly, possible high blood pressure, diagnosis of cancer, obesity. They're not fitting that profile, and or lung conditions is a major one, and they're not fitting that profile, and they're having that serious stage of the disease and putting at risk of the need for a ventilator or actually the risk of death. So it's really important to note that we don't know who's going to be impacted. We don't have those details. We have a general idea, and we're trying to be more serious with the people who fit the categories that we know where it's risky. But really everybody should be protecting themselves. If not for yourself, for your family members, for your community, please stay home, please stay safe. Thank you for tuning in. From this video, please note there could be a high percentage of the population who's asymptomatic, who has the virus and is spreading it. The symptoms are delayed, so you can have it and your symptoms could take 4 or 5 days to kick in. And third, we don't know the whole list of comorbidities that make this virus worse. So don't think that because you're young and healthy, you're not at risk of the most serious stage of this viral illness. So please stay home, please stay safe. Follow what your local and provincial and state and federal governments are recommending. Thank you for watching. This has been the Daily Vlog. We will see you next time.